ExdionCA's flagship SaaS-based solution, ExdionCA, is an automated CDI platform clients love to adopt. Built using AI and ML on a proprietary rules-based engine, ExdionCA automatically flag encounters with potential gaps, enabling providers to stay compliant and maximize legitimate reimbursement. ExdionCA team handholds the client not just in implementation, but also training for broader adoption across different centers. The highlights in the video you are going to watch now. See how ExdionCA provides comprehensive CDI training to the providers.
Ronnie Berlin, I'm from Exdion, and we've been working with you guys for the past few months. We are here to do continuous documentation improvement. We've been going over reviewing all of your charts to see and to assess your EM levels, treatments that are being done or not, and we came up with, after we created this utilization review, we realized that we need to address some issues. While most of everyone are doing a great job with documentation, with patient care, there are some deficiencies in documentation that could be that could get better. So we created this process that is going to allow us to help you, lift you to where you need with your documentation. We know you're treating your patients the best way that you can, and and it's wonderful, but it needs to be reflected as well in your charting. So we're going to discuss today the quality issues and patient satisfaction, documentation issues and compliance, the provider's documentation habits impact reimbursement. So we're going to talk about that too. Production of reliable medical records and promote profitability. So, and we're gonna go over some clinical documentation practices. There were 8,774 urgent care centers. It grew almost 10% the following year to 9,600. So there is an increase of amount of urgent cares. We see that it's very important to everyone that the wait time, 30 minutes or less to see a provider and total time of 60 minutes or less. These are the KPIs they are looking at, and they keep tracking it every year. So it's very important how we are dealing with at the urgent care with our patients. You are the practitioner. You're signing that document. You signed that you gave a chest X-ray to a foot pain. So just go over. Don't assume that the MAs and the radiology tech, they're very busy too, and they get distracted too. Just make sure that your chart is, when you are doing it, make sure that it's compliant. I'm not sure they're going to pay for a chest X-ray for a foot pain. So basically, that goes back to, there was an X-ray done, which is great. She's complaining of an ongoing pain. Tramadol, wonderful. ACE-RAP applied to the right foot. Walking boot given. Toradol, catalog. Great, But if there wasn't for Dr. Gross's ICD pop, that patient maybe not have given, or would not have received any treatment at the time of service.
Three observations I've made with us working with Exdon, and I know what FMC wanted to accomplish, and Exdon is enhanced. Two of my questions, one is a goal. The first is the care meeting the expected quality of care for the diagnosis that you entered? Meaning if they came in with acute bronchitis and the trend of urgent cares is to get a shot and a chest x-ray and a breathing treatment, did you do that? They're not saying you should. They're not saying why, that's wrong that you didn't. What they're saying is the data shows that most of the time in an urgent care setting, those things would have been provided. They're just asking. So we want to meet the quality of care expected. Now, some of those questions, I'll tell you, are because it's a dumb computer. Maybe dumb questions, like cellulitis and abscess. We don't IND cellulitis, we IND abscess. And that was keying off the artificial intelligence was keying off the wrong word. We got rid of that and it's not happening anymore. So that kind of evolution of this will occur. So that kind of answers your question. So what we want to do is make sure we're meeting the expected quality of care. That's the first thing. The second is where there are missed opportunities for treating the patient. That's another thing. Or could we have done something to make them better? These are urgent cares. These are family practice clinics. It wasn't a telemedicine. They paid $2 and called some guy in Dallas. They came into the clinic. They wanted to be treated. Did you miss an opportunity? And the third thing, and I really thought about the wording on this, this is our goal, is the enhancement of a level of care by the optimal placement of data and assessments within the chart. That means we want to do the same thing we're doing, but put it in an area of the chart where we get paid for it. Does anyone deep down have a problem with any of those three things? Meeting quality of care, trying to catch any opportunities, and putting things that we're doing where we get paid for it instead of doing it free? Anything. Tell me if you do, or forever hold your peace. Not really, I'll talk tomorrow. But you see what I'm saying? This is not confrontational. This is nothing, and it's not personal. This isn't a computer asking questions according to trends nationally and trying to accomplish things where you get paid, and you need to know how you get paid and why you get paid and calculate your bonus according to where you put the data. You're already doing it. Don't you want to put it where you're going to get paid for it?
So if you're an employed provider, the way that your formula works is your collections over the quarter. So month 1 of the quarter, month 2 of the quarter, month 3 of the quarter, the sum of your quarterly collections, not what you billed out, but what we've collected, okay? Subtracted from that is your personal expenses, so your salary, your payroll tax, your employee benefits, if we paid for any CDI classes or any of those personal expenses, comes out of that, and then the net of that total, which is what we call your net collections, times 2.5% is your bonus calculation for that quarter. If you're a nurse practitioner or employed doctor, if you're a clinic administrator or staff member, we take the net of your clinic, and there's a formula, and there's different ones for different clinics based on if your doctor's an owner or if it's a Care Express. There's different agreements with different owners, but most of it is based on the net income. So what's brought in goes into what the administrator gets, what the MA gets, what the RN gets, and it's mostly based on net income. So if you're not billing out the proper amount, and there was an example where we had somebody who, we'd seen them, we'd given them a strep test, we gave them oxygen, we saw them for at least an hour, but then we chose to not charge them. That affects everybody else around you. So that's one of those things we wanted you guys to understand is, it's not all about money, and that's not why we're doing this ExdionCA process. The ExdionCA process is about a lot of things. It's about better documentation because there's liability on doctors' licenses. There's liability on the company if something happens to one of our patients after it. So we want to be bulletproof. We want to have all the information in there that says what we did. So that's why just putting in flu shot and then leaving everything else blank, listing that they came in and requested a flu shot. We observed them for 15 minutes. They were fine when they left. Takes care of a lot of problems. But if you don't document it, you didn't do it. That's why those takes care of a lot of things. But we want to be a great company. We want to treat our patients and do the best job that we can. We want to be the go-to provider for all of. But that takes money. And so if we're underbilling or undercharging, we're doing services and we're not billing for those, that affects our ability to do our mission, which is to provide great care, for the families in our area. So those things are all important, and coding and charting and billing are part of that.
ExdionCA implementation is simple, easy, and impactful. Clients can try out ExdionCA, free for 100 claims generated by their EMR. Using this, our team will showcase the revenue you are leaving on the table. Come embrace the change, drive revenue growth.